Ever scrolled through social media and thought, that sounds scientific, but is it really? With so much health noise online, it's tough to separate fact from fiction, but that's exactly what we're here to do. My name is Jess Stokes-Parish. I'm an educator, researcher, and critical appraisal enthusiast. In this series, we're breaking down research papers, uncovering red flags, and sharpening skills to think critically about health claims. Whether you're a health professional, a student, or just someone who loves busting misinformation, you're in the right place. Let's dive in. Today, I'm reviewing this paper recently published in the International Journal of Colorectal Disease. Thanks heaps to the butt doctor for sending this one in. It's a paper about women's preferences on the presence of chaperones during proctologic exams that are conducted by male physicians. First up, you're probably wondering, what are proctology exams? You would probably be more familiar with this procedure being described as a rectal exam, where a trained practitioner looks for abnormalities in the rectum or in anal area, and it's an internal examination. And this paper is all about whether chaperones help women feel more comfortable when they're having an intimate examination conducted by a man. We'll use CRABS as a first pass tool to systematically assess this research. C for conflict of interest. The authors declare no funding was associated with the research, and they don't appear to have any other visible political or financial conflicts. R for references. Because this work is a reference, I'm going to cover R after working through the rest of the mnemonics, so hold tight for that one. A for author. These authors are consultant colorectal surgeons and researchers from Brazil. They're affiliated with large universities and also with one of the largest universities in Brazil. B for buzzwords. There's not really any buzzwords here. It's a pretty stock standard scientific paper. S for scope of practice. The topic of rectal exams is within the author's scope of practice, but the research question might be slightly out of scope, which I'll explain when we dig into the paper itself. So let's dig into R, or the reference, because this is where the meat of the paper is, and this is where we get to look into how they've done this research. So with any paper, I use a systematic approach. So I skip the abstract until looking at it right until the end, and I go straight to the introduction to try and get a sense of what the background information is, and then I go to the objectives to get a sense of what the purpose is. So the objective of this study, there was three. One, to assess female patient perceptions regarding the presence or absence of chaperones during rectal exams performed by male physicians. 2, to determine how protected they felt during their exams. And 3, to evaluate their preferences regarding the presence of a chaperone at future medical visits. So I'm now reading through the methods, and they designed a 2-armed parallel randomised clinical trial with an allocation ratio of 1:1. So basically, they put women in 2 different groups at random points in 2 separate outpatient clinics in Brazil. I'm a little bit on the alert at this point because we're talking about preferences and a randomized controlled clinical trial. Why are we using a randomized controlled clinical trial to assess women's preferences? The second concern I have is that they reference a PubMed search to identify the absence of clinical trials on this topic, but they don't allude to any other databases which would be important for this kind of topic because it's about patient preferences as opposed to proving a right or wrong outcome. And at this point in the background, they've only really included evidence from the physician's lens and not from the patient preferences lens. They don't include any relevant information in regards to intimate examinations, what we already know about intimate examinations and education. And I'm beginning to feel a little bit like we've gone down the wrong path, but I'll continue and see what else I can find. So in terms of the participants, they were either enrolled into a group where there was a chaperone or where there wasn't a chaperone. They proceeded to go into the hospital or the clinic and have their intimate examination. And then after the intimate examination, the researcher asked if they would like to join the study. And if they did want to join the study, they signed and got informed consent and they completed a survey. The survey consisted of 6 questions. It was developed by the authors and was allegedly validated by a range of practitioners that work at the hospital, but they don't actually provide any data on that content validity or the reliability of it. And what that means is that they made a questionnaire for the purpose of the study, which is fine. They used it, but they didn't validate it statistically. So we don't know if it measures what it says it measures. Now, at this point, you would have heard that I said that they were enrolled into one group or another group. One had a chaperone, the other didn't, and they didn't know that they were getting something different. So I'm feeling a little bit on edge here about the ethics of the study method. And the reason why I'm concerned is because the participants were not given a choice as to whether they could have a chaperone or not. They were just randomized to one of those groups. Now, the reason why they did this was they didn't want to create the Hawthorne effect. The Hawthorne effect is where somebody becomes aware of the intervention and then changes their behavior based on the intervention. So the researchers wanted to minimize that, which makes complete sense. But it does mean that the 2 groups received different clinical care, and it's not clear from the study as to what the normal clinical care is in these settings. So we don't know whether it's normal for these exams to have chaperones or not. If normal care in these hospitals does include a chaperone, then they've just removed the chaperone for half of the group, which means that those participants didn't get normal clinical care, which would be an ethical concern. So coming back to the methods, were the methods appropriate? A randomised control trial, in my view, is a bit of a strange choice to measure preferences. If I was wanting to measure somebody's preferences, I would probably have done a survey or a focus group. So using a quantitative measure like this to assess preferences is a little bit of an odd choice. They did include some really good protective factors, like having their survey completed by a female research assistant and the physician who conducted the intimate examination was not present. So this would reduce that risk of kind of coercion and the power imbalance to complete the study. So does this study address the objectives? So remembering that the first objective was to assess female patients' perceptions regarding the presence or absence of chaperones during rectal exams performed by male physicians, I'm not really sure that they address this first objective. The most common method to determine patient preferences is to use qualitative research methods. That is, they explore the how and the why, as opposed to justifying a relationship or proving a hypothesis. There's no hypothesis to prove here because we're exploring preferences. And this is actually somewhat common in medical research, where medical researchers inappropriately choose quantitative research methods where qualitative research would have been more appropriate. This might have given us a better understanding of how the patient actually felt with or without the presence of a chaperone and what they would have preferred and why they would have preferred it. The second objective was to determine how protected they felt during the exams. I don't think they addressed this objective at all. There was no definition of what protected meant in this context, and there was also no exploration or consideration of what safety means in an intimate exam. And this is a missed opportunity, because I think if they had done qualitative research, they could have answered this question a little bit more from the perspective of the patient. The third and final objective was to evaluate their preferences regarding the presence of a chaperone at future medical visits. In my view, this is quite a reworked version of number 1, so I think the answer is the same here. I'm not sure that they answered the question. When I looked at the broader field of research on this topic, there have been many studies exploring patient preferences for intimate examinations. Of the handful that I read through, they used survey methodology to explore this issue, and they came up with the conclusion that all patients should be offered a chaperone for intimate examinations, but not all will want a chaperone. So, the verdict. The authors made the conclusion that a chaperone should not be mandatory and is an individual preference that should be patient-centered. They also make the assertion that guidelines that recommend a chaperone should be reconsidered on the basis of their research. I don't think they can make the recommendation for guideline changes from their studies because I'm not convinced that their research methodology actually addressed the question of patient preference. But it does seem that the assertion that a patient-centered approach to using a chaperone is consistent with more reliable findings in the field. Well, that's a wrap on today's deep dive into patient preferences for chaperones in intimate examinations. Hopefully you're walking away with a sharper eye for research credibility and a few new tools to critically appraise research like a pro. Remember, just because something sounds scientific doesn't mean it is scientific. So always ask questions, check sources, and think critically. If you found this helpful, let me know in the comments. I'd love to hear your thoughts, whether you like this format, whether you have a paper or a topic you want me to break down, drop it below. And don't forget to hit like and subscribe so you never miss an episode.